Good morning, Dr. Lebowitz at the Long Island Gynecomastia Center. So I'm not doing surgery today. It's my day off, but I'm always working. What the hell? So I got this young man. I did gynecomastia gland removal surgery on him literally 2 years ago, over 2 years ago, like 2 years, 2 months, something like that. And he's got great results. But, you know, perfection is my middle name, and I don't know how he views himself as being perfect, or what the shape and contour and dynamics of his chest, what he expects and wants. So he looks amazing. The glands are gone. Now focus in on the scar, number one. Now, you know, the darker skin you are, the worse you could potentially heal. But look at this great scar. Look at this side. He's right-handed, so the scar on the right could potentially be a little bit more because of the movement, but look at the scar even on the left. It is perfect. The scar is literally right there, but you can't see a damn thing. Now, also look when I put my finger in here. The gland is gone. See that? The gland is gone on this side too. See that little, when you push down that little space, that's gone? The gland is gone, no longer there. Now make a muscle, kind of do that. And as you can see, there's no abnormality of his muscle. There's no concavity, there's no nothing. Little puffiness on this side, and this is what he's complaining. This side, he's pretty much 99% thrilled with this side. This side, he says, Doc, when I do that, it's a little puffiness. So I'm gonna use Kenalog, no, relax, I'm sorry. I'm gonna use Kenalog-10. You wanna use Kenalog-10 because if you go, you know, it's 10 milligrams per cc. That's kind of what it means. If you use anything higher, you could really potentially cause atrophy of the skin, of the fat, and worsening of any kind of concavity. So you gotta be very, very cautious and careful at this. Now, he's local, he's from New York. If you're from, let's say, California, you have my surgery, you call me up, we do a FaceTime, and say, Doc, I got a little thing, a little scar tissue. I send you the bottle of Kenalog-10 with the insulin needles, and you do it yourself while we FaceTime, Skype, or WhatsApp. He's local, we don't have to do that. So, getting back to him, the concavity's there, but what I'm gonna do is give him some shots kind of at the periphery to kind of blend in where the gland is gone and the natural volume of his chest. Now, he's a big guy. He's not, you know, what do you weigh?
230.
230, so he's not a 180-pound little guy. He's got muscles, and he's not a, you know, he's not bone thin, but he's in good shape. So he's got some normal fat. We did not do lipo. He's got some normal fat around there. So this is the way I can blend it in, even post-surgical. 2 years later, I can kind of atrophy a little bit of fat to make him look great without causing any indentation. But as you can see, that gland is no longer there. So I've already alcoholed him down. You got to make sure everything's clean. And with this is the Kenalog-10 in there. I preloaded it. And really, as I go, I'm just gonna give a little bit around it. You can't, you know, don't overdo it. Because if you overdo it, once you do it, you're stuck with it. So basically, just go around it and atrophy a little bit of fat. Do you feel anything?
Yeah,
little pinches.
Little pinches.
And people tell me also, by the way, people say, oh, Doc, will I have like numbness on my nipple post-op? I can't have numb nipples. Are your nipples numb?
No, they feel fine.
They're not numb. So don't worry about having numb nipples. Unless you're a numbskull. That's a joke. All right. And then once I do this, I want him to just kind of mush it around.
Yeah.
So that's one side. This is the Kenalog-10. This is what I'll send you if you need it, if you have surgery from me. And I've got people who have had surgery from other doctors. I got one guy in Miami who had surgery from somebody in Miami. The doctor in Miami did not know or does not know about this and how to do it, refuses to do it. Guess what? He's flying to me from Miami for one day on a Saturday, coming first flight in the morning. I'm gonna do the Kenalog shot, and he's gonna fly out in the afternoon. And once you are established as a patient of mine, I actually will make an agreement of what to do, and I'll send you home with a bottle of this, and we'll do it together. So I even do it from other doctors who had surgeries who don't know about it or refuse to do it. So as you can see, no needle marks. Everything's great, and he's going to massage it and roll it, go to the gym, lift, build muscle, eat right, eat clean, and do everything right. Stay away from gynecomastia-inducing things like environmental stuff like soy and non-organic, foods that are, injected with steroids. And just eat clean and exercise, and you do good, I'll do good, and we'll do good. Thanks, and see you soon. Dr. Lebowitz Steroid Kenalog-10 injections, post-gynecomastia surgery for any scar tissue buildup. 631-424-0101 or email me at jonathanlebowitzmd@gmail.com. Thanks, and see you soon.